All right, cupcakes. Well, we're here today. This is Intro 3, Week 2. And guess what we're studying? Reproductive systems, as if you didn't know. But you'd be amazed. I've had some students ask me some strange questions, but no question is strange if you got to ask it. So if you have any questions, give me a text, give me a call, whatever you have to do. One student asked me one time if you can get pregnant from a toilet seat. No, not really. No. All right, let me show you what I have here. Okay. Right up here, I put know these. This is everything about the male. This is everything about the female. All right. This is a symbol for male and female. These are their sex hormones, the sex glands, which we call gonads, or the sex cell. It's one cell, which are gametes. Now, for the male, the sex hormone is testosterone. The sex gland or gonad are the testes. I know what everybody thinks it is, but you're wrong. It's the testes. And the sex cell or gamete, one sperm is one cell. You can't even begin to imagine how tiny that is, all right? Now, ladies, yes, men do have a little estrogen going through their systems. Just like, guess what? We have a little testosterone. Because if we didn't, we would have no libido. Libido. If you don't know what it means, look it up. Okay? Now, the female sex hormones, we have a lot more than two. And I'm going to tell you something about that in a second. But the main ones are estrogen and progesterone. Our sex glands or gonads, easy way to remember it. Gonads has a O and ovaries start with O. Those are our sex glands. I know what you may be thinking. The sex cell or gamete is the ova, which is plural. Ovum is singular, meaning egg. Now, I was going to tell you about the hormones that ladies have. You're going to find out through this course this week that we have about 5 or 6 hormones that do this in 20, not that, but they do this in 28 days. So it's a wonder there's not more women mass murderers and bank robbers, because if we can hold it level, or as level as we can hold it, for 28 days with all of these hormones, and you're going to find out follicle stimulating hormone, luteinizing hormone, all of these hormones besides these, it's a wonder, okay? All right, these diagrams are on the test, and there is a word bank. Now, you're blessed. I'm giving you all word banks because I have yet, in all of my years in working in the healthcare field, I have yet to see a patient come in with stickers all over their body like a word bank. Here's my mandible, here's my maxilla. No, doesn't happen, all right? Okay, let's get going on the guy. The guy's first, all right? We're going to start right over here. What this is right there is the urinary bladder. We both have it, urinary bladder. What's down right here, this little part is called a seminal vesicle. Seminal vesicle. This is the prostate gland. It's got that tube going right through the middle of it, but it does it in real life. It just, that's the way a drawing is. Look at the close proximity of the prostate to the bladder. Remember last week we were studying a benign prostatic hypertrophy? When the prostate gland enlarges, it pushes on the bladder and causes urinary incontinence. This is a tube leading from the testicles all the way up to the penis, and that is known as the vas deferens. Yes, there's a vas deferens between males and females. This right here is the sac, and that is known as the scrotum. What is housed in the scrotum are the testes or testicles. Right here we have the organ, and it is the penis. And then this tube that goes from the urinary bladder, and if you follow it, go all the way around and come all the way down, it leads from the bladder to the exit of the penis, all right? And the urethra is both the penis is both a passageway for sperm and urine. But I'm gonna explain it to you. You're not gonna get a 2 for 1. Don't worry about it. Okay. Now you notice a lot of the guy's stuff is on the outside. And I'm going to tell you something. A lot of the things we're going to look at, this is chapter 7 and 8 in your textbook. And a lot of things we're going to look at in the male, the whole purpose, the sperm leaves here and it has to travel like a marathon to get out of the male's body. It's like if this was a fish and the fish is in the water, right? Well, if I took the fish out of water, what would it do? It just kind of flop around and not go anywhere. Sperm would do the same thing. Sperm have got to have fluids. And most of these organs that we talked about, the seminal vesicles, the prostate, the vas deferens, a lot of these organs, it's like getting on a bus. You get on the bus at the testicles, and you're gonna get off at the penis. But in the meantime, you got to stop and let other people on. That's the other fluid. So the sperm starts in the testes, and it's going to go all the way around and stop and make pickups. So the sperm has fluid to move through. The sperm is going to have a trip that is out of this world, literally. Look where it's got to go. From the vajayjay all the way up, and then it's got to make a decision. And you know guys are not good at stopping and asking directions. Half of them get it wrong. But anyway, a lot of the guys' stuff's on the outside. Our stuff, like ladies, is on the inside. All right, we're going to start right here. This organ, the size and shape, well, actually the shape of a pear, but the size of a fist, is the uterus. And there's 3 different parts. You have the top part, the fundus, you have the corpus or body, and you have the cervix, which is the neck or the mouth. It's all part of the uterus. Then we have the vagina. Vagina is about 3 inches long. Okay, over here, now let me show you. These are the fallopian tubes. You have one on each side. Notice these are ligaments right here that hold the ovaries. These organs are the ovaries. Now let me explain something to you. I don't know, I hope to teach you something this week that you didn't know about your body. And I think I'm going to go for it right now. I don't know if you're aware of it, but every little girl is born with every egg she will ever have. That's why the older a woman waits to get pregnant, the eggs are not Eggland's best. They're not organic, okay? They may be starting to show a little age, a few wrinkles. Right here, what we have, this is the egg right here. But the egg inside the ovary is like inside of a shell. You got the ovary, and then you have the follicle, which is like the shell that holds the egg. Then once a month, because of the hormones secreted from the brain, telling our bodies what to do, once a month, one egg will go to the surface of the ovary. It will stand there or sit there and stay there for a little bit, and then it will rupture. The follicle or the shell will rupture. The egg will actually be out in the abdominal cavity. The fallopian tubes, you notice these little wave-like on the end? Those are called fimbriae, and they act like fingers. If you ever seen like coral in the bottom of an ocean, and it just kind of moves with the motion of the ocean, you get it? Well, the same thing happens here. The end of the fallopian tubes are called fimbriae. We're going to get to all this in the notes. And these go around, they just kind of like wait and suck up the egg. Then the egg travels down the fallopian tube. Now, let me tell you something. And I'm going to tell you this and tell you this and tell you this. Get it? The fallopian tube is not attached to the ovary. Let me show you on the other side. It looks like it, but the fallopian tube is not attached to the ovary. All right? Got it? Okay, let's get started with the notes. We're on the page with all the vocabulary words on them. All right? And if I didn't love you, I wouldn't tell you that you had to study these. All right, now these are also going to show up in the notes, but I want to make sure you know them and see they're highlighted. The first term is areola. Look at my hair, it looks terrible. The areola, that's the colored area around the nipple. Both males and females have areola. In fact, both males and females have nipples. The cervix, that's only women. That is the lower part of the uterus, or the mouth of the uterus. And normally I'd have a big overhead and put this on the board, but that's the cervix right there. When you are pregnant and you're in labor, this is what has to dilate. Your cervix has to dilate, all right? Okay, DNC stands for dilation and curettage. And dilation is just what it is. It's going to dilate the cervix. Curettage means to scrape. And what it is, it's the scraping of the cervix and uterus, usually with the products of production after it's not viable, after a miscarriage. If you don't pass all of the products of production, then you'll do a D&C. The next term is fertilization. Now, fertilization and conception are the same exact thing. It is the union of the ovum, which is the egg, and the sperm. All right, now we're going to have different stages for the little bitty baby. All right, it's cute. The next term is fetus. Fetus, now this isn't the first stage, but this is one of them. It's from 2 months of pregnancy until you deliver. So next time you have a friend of yours and she's pregnant and you go up and you don't go, oh, how's the baby doing? How's the fetus doing? You're going to go, how's the what? Fetus? Okay, I guess so. This term, and I'm going to pronounce it, and I know you're going to think I'm nuts, but I am, but anyway. This is how you pronounce it. It is menstruation. I know everybody says menstruation or menstruation or whatever. It is menstruation. That is the shedding of the uterine lining. Once a month, the lining of the uterus becomes very, very thick and engorged in blood, waiting for a fertilized egg to come down and implant. Well, if no fertilized egg comes down and implants in the upper third, that uterine lining has got to be shed, and the egg disintegrates and dies and goes out with it. And that is menstruation. If you knew what was happening, you'd understand why you have cramps. Literally, the walls or the inside of the uterus is being ripped off. It's nice to say it's shedding the uterine lining. BS, it's ripping that sucker off, okay? Just want to let you know. All right, so that was menstruation. The next term is hysterectomy. Now, hystero means female, and there's a movie called Hysteria, and if we were in school, I would show it to you. Women back in the late 1800s were thought to become hysterical once a month. They knew about the menstrual cycle, but what had happened was it was just like PMS, and they would, well, they were going to this one doctor, and he discovered if he manually, with the hand, stimulated these ladies to orgasm, they felt better. All right? And that's why women were said to be hysterical, hystero. Ectomy means surgical removal of. That's the abbreviation, surgical, SX. Surgical removal of the uterus. That's it. Uterus. That's all they're taking out in a hysterectomy. If you want to get further, we're going to have to get into the salpingo-oophorectomy. I'll show you that later. Salping is the fallopian tubes. Oophoро is the ovaries. That's a complete, one of those, hysterectomy. Salpingitis. Salping means fallopian tube. I don't know who named that, but somebody did. Itis, we know, means inflammation. This is inflammation of the fallopian tubes. And I want y'all to notice, I think I'm doing pretty good reading upside down and backwards. Oh, it's going to come up and bite me, but that's okay. Retroversion. Now, if you look in your book on chapter 8, you will notice that the uterus in a female is tilted toward the front. Okay, here's the cervix, and this is the abdominal cavity. It's going to go just like this. It's going to tilt toward the front. Retroversion is just the opposite. Retroversion is a backward displacement of the uterus. Now, this can interfere with becoming pregnant. This can lead to sterility because of the placement of the uterus. All right, the next one is dysmenorrhea. Now, if somebody's dissing you, it's not good. Meno means menstrual cycle or menses, and rhea means flow. Painful menstrual flow. And look what the definition is. Painful menstruation. See, if you can figure these out, you got the definition. IUD stands for intrauterine device, and that is a method of birth control. This is inserted by the physician and it stays in place, okay? All right, next one, we have sperm. Sperm is the male sex cell or gamete. Male sex cell or gamete. And look what the next word is, gamete. Specialized sex cell of either the male or the female. Estrogen is a female hormone. Progesterone is a female hormone. And sterility is the inability to reproduce in either the male or the female. It can happen either way. I'm going to give you a little hint. If people are having trouble getting pregnant, look at the type underwear and top pants the male is wearing. If they're wearing a little tighty whities and a cute little blue jeans that keeps everything really uptight and tucked, not good. Sperm, that's why the look at the testes. The testes, well, I can't show you a real one, but anyway, the testes are outside of the body. Body temperature is 98.6. Sperm can't develop or grow at 98.6. That's why the testicles are outside of the body. And if they're wearing these cute little underwear and stuff that's keeping the testicles way up near the body, you may have trouble getting pregnant. That may be just one cause, okay? All right, the next term is orchitis. Well, we get gonorrhea and menstruation. They get orchids. Orco means testicles, and itis is inflammation. So that's what it is, inflammation of the testes. Okay, next term is uterus, and that is the muscular, pear-shaped, the size of your fist, female organ. Now, when I say muscular, I'm talking thin layers, but it's got lots of them. It's thin layers of muscles. And why is it like that? Because you would never be able to give a vaginal birth if you didn't have the muscles, okay? But it's a lot of thin muscles. All right, next term, fibroids. Now, fibroids are tumors in the uterus, usually benign. Not what you're going to be before you ate, but not malignant, all right? But let me tell you something, just like it says right here. They may require surgery. The signs and symptoms include backache, abnormal bleeding from the uterus. I mean severe pain. It's called breakthrough bleeding. You've already had your menstrual cycle and it comes down again. And it is painful and it can last for a long time. So what the doctors can do is fibroids. Remember I told you the uterus is layer and layer of muscle? Well, normally your uterus is like this, nice and smooth on top. But when you start developing fibroids, your uterus starts to look like this. Instead of nice and smooth, it looks all bumpy. And guess why? Those muscles have started to grow on themselves. And instead of the uterus being nice and pear-shaped, it's all bumpy. And the doctor can give medication and it will shrink these. And then they can go in and cauterize them. And usually that'll take care of the problem. If not, and you no longer want any more children, they may just do a hysterectomy where they remove just the uterus. Keep the ovaries as long as you can because that's what produces the hormones. All right, embryo. Remember I told you we had fetus up here and that was from 2 months to delivery? Well, guess what? Embryo is sooner. Embryo is from conception to 2 months. You may not even know you're pregnant with an embryo, all right? So embryos first, and then you have fetus. Actually, it's called the zygote first, a blastocyst, like a cell. Okay, abortion. Now, this is just FYI that I put here. This abortion is the premature termination of a pregnancy. Now, there's 2 basic types. You have spontaneous, and that's commonly called a miscarriage. Or you have an induced or scheduled abortion. And that is when an appointment is made in advance of the procedure at a specialty facility, okay? Now, what I have down here is strictly for my loved ones. I just want to go over it real quick. Ladies, you using tampons, I want you to be real careful and read the box. It's called toxic shock syndrome. Back in the late 60s, early 70s, they only had regular tampons. I mean, that was it. Tampons were just, And so some women were inserting 2 because their flow was so heavy. Well, it stopped the flow so good, they forgot they had them in. And yeah, no, That's just from one point of view. But toxic shock is an infection usually associated with prolonged use of tampons. So then they started making super and super, super duper, super, super duper. And that's where really the toxic shock came in because women were not removing and changing the tampons as ordinarily as on a schedule like they would if they were using a regular tampon. Women died from this, okay? Toxic shock. Toxic is poisoning. It's systemic. It becomes throughout your body system. A tubal ligation is cauterization, which means the burning and the division of your fallopian tubes. And this is a form of female sterility. Para, gravida, and abortion, these are all abbreviations. Now down here, please study these for real. Hystero means uterus or female. Meno means menses. Ufero, remember I told you uferosalpingectomy? Ufero means ovary. Ova is the combining form. All of these are combining forms. It's the prefix and then the combining vowel. Now notice the beginning of each word tells you what's going on or what organ of the body. Ovo is egg. Ovario, come on, is ovary. Salping, we know that means fallopian tube, okay? And utero is uterus. Vagino is vagina. Gotta look. Oh, rhea. Now notice I put a little line in front of this. That's a suffix at the end of a word. Rhea means, can't read backwards that much. Discharge or watery flow. You've heard it used at the end of diarrhea, all right? Dis is difficult or painful. And retro means backward. So instead of the uterus tilting toward the front, it tilts toward the back. All right, anybody got any questions? Okay, Cupcakes, you got a worksheet at the end of your notes, so I would appreciate you going over that, and we're going to review that come Wednesday. All right, we may not be able to get too much. If I get cut off, we'll have to do a lot tomorrow also. All right, we're on this page right here, reproductive system. Gynecology is the study of the female reproductive system. Reproduction or fertilization is the union of the sperm, which is the male sex cell or gamete, and the ovum or egg, the female sex cell or gamete. Now, fertilization is also known as conception. The male sex cell, okay, is the sperm. The female sex cell is the egg. Both of these are known as gametes. Now, stick with me on this. Each gamete contains 1/2 of the number of chromosomes, which is 23. Every other cell in your body, in the human body, contains 46. So you have to have 23 with the egg, 23 with the sperm. So when they get together, it makes 46. But regular cells have 46. Only the gametes have 23. All right. And guess what, guys? It's the male that determines the sex of the baby. So I don't know if y'all remember King Henry VIII. He married and divorced. No, divorced. He was killing his wives because nobody gave him a son, and he wanted a boy. Well, guess what, chump? They should have killed you because it was you deciding the sex. The male determines the sex. And how? Female, we only carry X chromosomes on our female chromosomes. Male gametes or male sex cell, the sperm, carries X and Y. So it just depends on which sperm gets there first. Female gonads or sex glands are the ovaries. Gonad, ovaries. Male gonads or sex gland are the testes. Gonads are the organs which produce the gamete. So the gonads are the organs that produce the sex cell. Conception takes place in the fallopian tube. Yes, conception takes place right about here, all right? And then it travels down the little river like tubing, all right? And then hopefully implants in the upper third of the uterus. But yes, now a lot of times what will happen is instead of moving down the uterus, it'll stop. You ever heard of a tubal pregnancy? That's what happens. Now remember, your uterus is muscular. It's going to grow and grow and grow with the baby. Fallopian tubes are not muscular. Baby's not going to survive. then they're going to have to go in and remove the fallopian tube, probably. All right. Stages of digestion, excuse me, of gestation, which is pregnancy. You have the zygote from conception to 2 weeks. You have the embryo from 2 weeks to 8 weeks. And then we have the fetus from 8 weeks to 40 weeks, all right? Now, each baby girl, like I told you before, is born with every egg she will ever have. It's not until puberty that they mature, which is her first menstrual cycle. And the name of the first menstrual cycle, we had it last week too, is menarche, all right? Menarche. Now, males produce new sperm constantly throughout their lives, but they too don't become mature until puberty. Now, the female hormones are estrogen and progesterone. Flipping the page. The hormones are secreted because of the pituitary gland, a little bitty gland the size of a pea at the base of your brain, and it's the master gland. It tells all kind of other organs what to do. The hormones are responsible for the secondary sexual characteristics. Primary is when you have the baby, they hold it up and slap it on the behind and go, yep, it's a boy. Nope, it's a girl. That's primary. It's what you got right there. Secondary is what happens at puberty. The breasts develop in females. Both develop pubic hair, axillary hair. The males will develop chest hair, all right? Those are secondary. All right, organs of the female reproductive system. You need to know these. Ladies, we have 2 ovaries, 2 fallopian tubes, 1 uterus, and 1 vagina, all right? External genitalia, look in the book on chapter 8. What's on the outside is known as the vulva. Now, we have lips. We have 2 sets of lips, ladies, not just these, but those. You have the labia majora, think of major, like, or the outer lips, which are the larger lips. Then you have the labia minora, which are smaller or inner lips, all right? Okay, before we get started on the diagram, I'm going to go ahead and stop with this today. I know I've bombarded you with a lot of information. Tomorrow we're going to pick up, and I'm going to, what these numbers correlate to are the exact numbers on the diagram. Not the diagram like I showed you today, the one that's in your book in chapter 8, on page 260, if it looks right, okay? So we'll pick up with there tomorrow. I'm going to stop it, and then I'm going to come back and work on getting it uploaded, which takes forever. And I'll text you when I send it to you, and then I'll work on intro. All right? Okay, love. See you in a little bit.